So I remember that when we were talking, we were about the diagnosis, how to diagnose. I was really just talking about how toddlers or younger children are diagnosed. But for school age children, older children, they do psychoeducational assessments, and that can be done at, microcare. Any psychologists, clinical psychologists, they do these assessments, and um, that's a way too of diagnosing. So they have different rating screening tools that they use, a childhood autism rating scale. Um, they will use parents' evaluation of developmental status. They have screening tool for autism in toddlers and younger children. So, these are some of the screening tools that will be used also. So I just wanted to make it clear that not only developmental pediatricians do the screening, but we have psychologists who can also do screening for a diagnosis of autism.
Good evening and welcome to the program Talk with Tashi, a program dedicated to young people, adolescents, and adults. Discuss your issues and solutions with Tashi. And now, here is your host, Tashi.
Welcome back to another Talk with Tashi. And as usual, I have a very special guest with me. I am speaking today with Mrs. Christina Addington, and today we are talking about autism. So if you know someone who is a parent of an autistic child or someone who has to deal with autistic children, you do not want to miss this conversation. Stay tuned. All right, welcome to the conversation, Christina. Thank you so much for coming. And you are on the Unusual Grace channel. It has been a long time coming, but we are happy to have you.
Good to be here. Good to be here.
Could you tell our audience just a little bit about the work that you do?
Okay, so I work in the special education unit in the Ministry of Education. We are a unit that, our main focus is to provide services for children with special needs in the education system. So we go about helping, promoting programs, just being out there, working with teachers, working with schools, working with NGOs. But our main aim is to help the education system better provide access, equity, and opportunities for children with special needs. So children with autism will fall right into that group of persons who we provide services for.
All right, great. Just out of curiosity, I was in a conversation recently with some parents. I know of a parent whose child was recently diagnosed to be on the spectrum. And, she said that she has become more sensitive to children who may have special needs, because of what she has to deal with on a day-to-day basis. And the question was asked, is it that we have more children now who are being born with special needs or developing special needs, or is it that they had been there all along but have gone undiagnosed? Is there something that we don't know concerning, the number of children that it appears to be? Is there an increase?
Okay, so specifically for autism, I would say yes. The incidence of autism worldwide, it has been on the increase. As it relates to special ed in general, children with special needs, because we have seen improvements in technology, medicines, medications, what vaccinations have helped to do, you know, we are seeing now that we have children being born, children who would probably die in utero, children who would die shortly after being born. Now, medical advances, we are able, you know, they are able to be saved, and so they're living, and you know, so we have children with special needs, more children with special needs. Yes.
Okay, that's interesting. But before I wanted to ask a follow-up question on that, but before we get there, could you tell us what is autism for someone who doesn't know?
Okay, so autism really is or you know, ASD, autism spectrum disorder. It refers to a broad range of conditions characterized by challenges in three main areas: social skills, repetitive behaviors, and speech or nonverbal communication. So communication. So those three areas are the areas that are affected. And so you see the symptoms playing out, and a diagnosis is made after the child visits a developmental pediatrician, or you know, the child guidance clinic, somewhere where they have persons who are trained and are able to go through.
So we lost each other for a little bit, so let's jump right back in. You were talking about autism, what it is, and you spoke about three different areas where the challenges are, and how it can be diagnosed. And as you are talking about that, let's so a parent wants to find out, they're suspecting that there is a challenge with their child. They're wondering if the child is on the spectrum. How can a parent find out? How can they know for sure?
So as I was saying, you know, they can go for usually at the clinics. So any of the child guidance clinics attached to the public hospitals, they have their pediatricians, you know, and especially the developmental pediatricians. They have persons who are trained, and so they can do the observation, do the inquiry, you know, the testing, the questioning that need to be asked to the parents if the children are very young. And so they get the information from the visits, from the observations, from the testing.
Okay, how early is too early for a diagnosis as it relates to being on the spectrum?
On the spectrum, well, usually what happens is parents begin, especially educators, persons who know typical child development, they know what it should look like. And so when the child starts to speak and use words, and then it just stops. Or when the child starts to withdraw into him or herself, we know that children at a young age want solitary play, but when they seem to be withdrawing, not communicating, not giving eye contact, then parents usually say something is a little off. And so about 3 years old, you would find parents deciding, no, it's not just, you know, a suspicion. I think we need to get something clearly, you know, stated, yes or no. Is there a real challenge, or am I just observing things that are not there? So that's usually the age where they would go and for some clarification or something definitive to be said.
About 3 years old.
About 3 years.
Okay, so you have touched on the symptoms, some of the signs then of autism. I note that you said they start talking and then all of a sudden they stop. Are there situations where the child's speech is delayed for an extended period of time, for example, 3, 4 years old, and still not being able to speak clearly? Would that be one of the signs of?
Right. So that can be, right? But remember, we say it's the three things.
It has to be all three?
Three together, because it could be a child with a hearing loss or something going on, some speech challenge. So that is why the developmental pediatrician or the person who is trained is the person who is going to make the diagnosis. Because they look for a child to be on the spectrum, it has to be three areas. The broad range of conditions, with the challenges in social skills, repetitive behaviors, and communication. So whether it is a speech or, nonverbal communication, because as we say, it's on a spectrum. So you have some children with autism who don't speak at all, some children whose speech, affected, and then some children whose speech, yes, is affected, but if they're going to therapy, which we'll come to later, part of treatment, that kind of thing.
Okay.
So it's the three areas, it's, the three areas which characterizes when we say, yes, they're on the spectrum.
Okay. Are there known causes of autism?
Okay, so truth be told, worldwide research has been done out here. Our Dr. Professor Samsvaughan at the University of the West Indies, she has been doing studies, research too. And there is no one cause. The research worldwide has shown that there is no one cause. Nobody can say definitively, this is the cause, that is the cause. However, research has shown that there is a genetic link and there's an environmental link. And research has shown that parents over 35, they are impacted at a higher level, right? But there is no cause to say why it is that they're seeing, the parents in this group, what is causing the genetic link, and what it is in the environment that is causing this. But so a lot more research is going on.
Can it be medically treated, and is there a cure? If a child, are they born with autism? Is it developed along the way? Is there a cure? Is there any medical treatment?
Okay, so
what is the nature of it?
To say that they are born, a child is born with autism. If there is a genetic link, if there is something in the environment, we can't say yes or no. What we know is that the symptoms and the signs begin to show at a particular age. What we also know is there is no cure. You can't go to the doctor to take antibiotics to get a shot. You can't, there's no cure. So the child, having been diagnosed with autism at age 5, will be diagnosed at age 15, age 20, 25. However, there are interventions, there are therapies that can be done. And so the child is better able to fit into the community, fit into his or her environment. And so the characteristics will be lessened with the treatment, and whether that's therapy or some parents, some persons too. We have had doctors from the States who did a session with some of our parents a couple of years ago, and she said that she herself had a child who was diagnosed on the spectrum. And so what she decided to do was to take her child off of all the highly processed foods and the foods with a lot of chemicals and stuff, And she said she saw, along with the therapy, that the child was being given, that the child really had improved. So, a number of interventions can be given, which will help, but it's not to say that the child will be cured.
Okay. And I noticed that you spoke about the child's diet, and you also spoke about treatment, which would be some kind of therapy. In Jamaica, how accessible are these treatments, and is it incorporated or ingrained into special education, or would parents have to seek these therapies separate and apart from the special education that their child would receive in the school system?
Okay, right. So the therapy which I'm talking about, applied behavior analysis, and applied behavior analysis really is therapy that is designed for children. Is intervention that has been designed specifically for children with autism. It's a scientific approach to understanding behavior. So persons are trained, it offers a set of principles that focus on how behaviors change or are affected by the environment, as well as how children learn, how learning takes place. So it's something that persons have to go and be trained in how to offer ABA. So it's not offered in the school system as a part of the regular program that the children have access to. But what we find, children on the spectrum, they prefer routines. They prefer when things are systematic and, things operate in a certain way every day, all the time. The routines give them some sense of comfort and allow them to feel some kind of control over an environment which they really don't have any control over. And so in the school setting, you'll see things like they have picture schedules. So, you have your timetable. So you have your timetable, but you also have picture timetables to help the children who are not reading, so they know what happens every day. It's the same thing every day, every time. If there's something that is going to be coming up that is going to throw out the schedule, then the children are told about it from weeks before. We are going to be having funny hat day on this day. This is what is going to happen. Or we're going to be having a special devotion. So, they have to be told and daily, so they begin to anticipate. Or when it happens, they're better able to cope. It's not just thrown on them, because then it will throw off their sense of control. Awesome. And then we will see what people say they're acting up, they're making noise, or they're hitting the airs, or they're making these loud sounds. But when things happen that they have no control over, it really sets them off. So the school system has the structure. The school system, special educators are trained, so they know the visuals, they know to use a concrete, they know the methodologies that work with the students. So in terms of that, the school system provides that for them. The treatment as it relates to the therapies, the speech therapy, the applied behavior analysis, those therapies, the occupational therapy, those therapies, they are expensive, yes.
Yes.
And they are really expensive, and so you find they're definitely not offered at the in the school system.
Wow. Is there anywhere in the world, and I mean, just thinking now, where these therapies are included? It's a part of the special education and probably subsidized by the government, so parents who otherwise wouldn't be able to afford, could
I'm
afford.
sure in first world countries that can afford it, it's a part of the system. It's included. Out here, we only have, I think, 8 speech therapists, and these speech therapists are all in private practice. All in private practice. We have a few ABA therapists, and they are 2 in private practice.
Could you just tell our audience what ABA is?
Applied behavior analysis.
Right. Okay.
Yeah, right. That's what I was talking about before. So, but we have a behavior therapist in the government system, and she works out of Randolph Lopez School of Hope. And so we have limited personnel in the government system. But what we do have from time to time, we have the behavior therapist. She will come and do training sessions with our teachers in the special ed school. So like last summer, she ran a training session, a full-day session in collaboration with the unit for the teachers. So she gave them strategies, she exposed them, just helped them to better understand. Best practices were shared, that kind of thing.
That kind of support is very important, and I'm happy that it is taking place. And I think more parents as well would need to be aware of these, events when they're happening, these sessions, so that they can benefit. One of the things that I have come across in my own reading and listening to some other therapists coming out of Canada and the United States and so on, is there is some research to suggest that there is a link between children who are autistic and gender incongruence. Have you any information on that? Have you noticed or observed that link in your own experience? What are your thoughts on that?
So generally in special education, that was one of the first things that jumped out at me. But in our training, we, readings and research, and we realized that for some reason, and it is in our Jamaican context too, we have more males. So I started out at the preschool for the deaf, and the classes had more boys than girls. Primary level, the same thing. And that's at the schools for the deaf. Going over to like a Randolph Lopez Carberry Court, where they have students with intellectual disabilities, that's what we're finding too. So as far back as from when I was in school and doing research, that's what the research showed, and that's what I experienced. Dr. Samsvon too, her research has shown her that of the 600 births, which the babies, because she tracks the babies, and then of the 600 births, she realizes that 500 boys are diagnosed on the spectrum to 100 girls.
That's
right.
That's
so she says
proportionate, yeah.
So in I think it was 2021, she spoke to the Jamaica Observer. No, she had, I can't remember where it was that she was addressing, but the Jamaica Observer covered the event, and they reported her saying that our rate has moved from 1 in 150 to 1 in 68 with her saying that of just under 40,000 births per year in Jamaica, you have 600 children born with a condition every single year. And the number includes about 500 boys and girls, there being more 600 births, 500 boys,
500 boys,
100 girls.
100 girls. Wow,
Right.
5 to
So,
1. Right.
yeah,
Wow. Okay. That is quite interesting. So the
yeah.
question now is then, how can we help children who are on the spectrum in contexts such as church, Sunday school, Sabbath school? Is there something that churches could be doing, something more, something different, something maybe that they're not doing elsewhere? Because we know that the teachers who are trained in the education system, they're doing their thing at school. But then, when they go to church, what can churches do to
Right.
cater
And
to these
I
children?
really, really love that question. You know why, too? Because we promote um, inclusivity, inclusion in the community. So if a parent has a child who is on the spectrum, the parent is not to go to church and leave the child at home, right? And so we think awareness, public awareness, so sensitization sessions. We have been asked, members from the special education unit, we have been asked by churches to do sensitization sessions. And so just like how we go into regular ed schools, we going to, churches have asked, we go in and help them to become aware of what autism is and how, the signs, the symptoms, how they can better prepare themselves to accommodate these children at church. And so some of the things I would say after you have the sensitization and persons are made aware, then there are things that can be done. So for the children on the spectrum, and it's a spectrum because there's a range. So what a child who is diagnosed as mild can tolerate or will need, a child who is moderate severe, the needs are going to be greater. But if you know the needs of the children or the diagnoses, what levels, then you can plan and put things in place. So we know that the children at a particular age, kindergarten to primary age, they want to be alone, self-play, that kind of thing. We know that there are not all of them, but some of them, hypersensitivity to sound and light, that kind of thing. So if the choir gets on very loud and the organ is loud and the child is going to be screaming and shrieking because the noise is too much stimulation for him or her, the overload. So things like allowing parents to have the headphones. You have headphones that children can wear to block out sounds. That's something that can be used. Just knowing that they're not going to be talking to you. If they're responding, there's not going to be eye contact. It's not that they're rude. It's not that they have no manners. So just knowing some of the characteristics, I think will help Sunday school teachers, Sabbath school teachers know how to accommodate them, things to do, because it's really important to include them. So if everybody else is coloring and they don't want to color, they want to be on the tablet, find something, a story, a Bible story that they can access. It's about giving the same content, but in a way that is more acceptable to that child or appropriate for his or her need.
Okay, so that means sometimes when these children are kicking and screaming at church, it's probably because they are triggered. And then some people are looking on to say that
Yes.
child is out of control.
And the
Sometimes
parents
the parents don't know what's
spoil the
happening
child.
either.
Right. So
Yes.
it's really important, I think, the sensitization. And yes, some churches, sensitization, I think after church or before church, you don't want to have somebody coming in and talking. So I wouldn't suggest that. But, breaking it down, something in a bulletin, there usually is a corner on the program, just some little tips to help persons know. And then you can have a speaker one evening at a more relaxed time where persons, are more open to hearing, so they understand, because a lot of parents are frustrated. Parents of regular toddlers. When my daughter was a toddler, I stopped going to the service that I would go to normally and went to another church at a different time in the evening, where it was, like 6 o'clock, because her running up and down, she was very active. And, some people, older people, are not ready for that. They think it's disruptive and all of that. So the child doesn't have to, be on the spectrum or have any special need, but just for us to understand too, as a church family, a church community, that we have to be there to support our brothers and sisters. So if they are having children who have challenges and are not quote unquote normal or atypical to what we are seeing, we have to learn to embrace them, because that's what community is all about. And if we're saying that we're trying to follow, then we follow the master as close as we can. So
that's right. I really appreciate the information, because I'm here thinking now, do we need to, like churches, do churches now need to develop some kind of curriculum to teach the Bible and about Jesus Christ for children with special needs? Because you spoke about some coloring, but that's not what the child wants to do there. So that whole matter of using images and so on, just to help them, because one particular methodology, even in the Sunday school, will not work for them. And I think what usually happens is parents who know that their children have special needs, they will choose not to send them to children's church or to Sunday school or Sabbath school or wherever, because they think that they are going to be mistreated, or persons might just think that the child is rude when the child is on the floor spinning around and doing all kinds of things. And some people are just they're not in the know, and they just don't have the level of tolerance to kind of manage these situations. So it sounds like we have a lot of work to do concerning these children. All right. Are there any final thoughts concerning, this whole conversation about autism?
So my thoughts, I really think the first thing is that we are to remember that a child who is deaf, a child who is blind, a child who has juvenile diabetes, a child who has sickle cell, a child who has been diagnosed on the spectrum, the first thing we need to remember about those children are that they're children. And just like how any other child wants to feel loved and cared for and nurtured, it's the same thing with children on the spectrum. How we relate to them and show them that we love them and care for them may be done a little differently, but if we understand how to do it, then that's, I think, the first step in really reaching the child. So knowledge is power, helping persons to understand about, autism, and then how to treat children with autism, things to put in place. I think that's really, really important. But at the end of the day, children first. So remember that. That's important.
Yes,
See the
thank you so
child before
much.
the disability. Yes.
Right. And that is key. Christina, thank you so much for having this conversation with me today. I am sure that persons who listen will benefit greatly from, everything that you have shared. Is there any a parent who wants support, a parent who has a child who is autistic and wants to find some kind of support and help, how would you advise such a parent?
Okay, so the first thing is the special education unit. We have an email address, specialedu, that's SPECIALEDU @moey.gov.jm. Our phone lines, we have challenges with the phone, but it's 612-5700-2. And once they call, they can be asked to put on to extension 2701 or 2704, or just asked to be transferred to the special education unit. So you call us as a, first contact so we can help you, because there are some areas in which we provide support. So call, speak to an officer, and we'll be able to better guide you. There is also the Jamaica Autism Support Association, and I don't have their number on me, but they can Google. That's an awesome parent support group, doing a fabulous job helping to support parents. As a matter of fact, they are having a conference coming up.
Yes, St. Andrew High School for Girls.
Right.
June 23 and 24. Yes, I'm aware of it.
Okay, great. So, yes, make contact with us and we'll try to assist as best as we can.
Awesome. Thank you so much, Christina, for this conversation. And thank you to our audience for tuning in to another Talk with Tashi. And if you have a child who is on the autism spectrum, there is hope for you. There is support that is available to you. And you would have heard the information. We invite you to make contact and get the support and the help that you need. You do not have to go through this on your own. And I want to encourage all churches to take a look at, ministry opportunities to develop curricula and to also just organize yourselves around caring for children with special needs in a different way. They are children first and foremost, as Christina said. And then when they have these special needs, then as a church, there are things that we need to do. The first thing is to become aware of what these special needs are about, so that we can allow this awareness, this knowledge, this information to inform how we operate and how we do ministry and how we support the parents of these children as well within that context. We're all about inclusivity, and parents should be comfortable to come to church and to take their child with them, regardless, of whether this child is on the spectrum or has some other special need. So thank you so much for joining us. It has been a great conversation, and see you next week again for another talk with Tashi.
Thanks for tuning in. Do join us next week, same time and on this platform, when you can talk with Tashi. Until next time, do have a safe, blessed and productive week.